Airway surface liquid is one of the fundamental problems in cystic fibrosis. When the CFTR protein doesn't work correctly, salt doesn't move correctly, and that in turn causes problems with how water moves across airway cells. Normally, the surface of the airways is supposed to have a layer of fluid that allows the cilia and the overlying mucus to move normally. In CF, the airway surface liquid is too small. It's depleted because the salt doesn't move correctly. And that causes the cilia to have difficulty moving the mucus builds up and begins the problems of infection, inflammation, mucus obstruction, and all the downstream problems that are really the primary source of pulmonary symptoms in cystic fibrosis. The ways that we're tackling the problems with airway surface liquid in CF are many. The pipeline is very full, and the approaches cross a number of different targets. First of all, CFTR modulators, or drugs that help restore function to CF-causing mutations, should improve airway surface liquid volume. We've been able to see that in preclinical testing, and certainly it's translated in patients to improvements in lung function. In addition, osmotic agents are things that sort of help draw water into the airway surface, and a drug such as mannitol, which is under development, does the same general principle. It helps draw water into that airway surface liquid, and that allows the cilia and mucus to move more normally. In addition, sodium channel blockers, which are called ENaC blockers or epithelial sodium channel blockers, block the resorption of sodium, help keep water in the airway surface liquid space, which in turn allows the cilia to move better, the mucus to move better, and reduces the risk of mucus buildup, infection, and inflammation. Drugs like mannitol and ENaC inhibitors, at least in some ways, are going to work a little bit like hypertonic saline. The hypertonic saline works by helping draw water into the airway surface, which should lead to more productive clearance of mucus, basically. So I think all of them, while they may work in slightly different ways, I would imagine that they're going to lead to, over time, less cough, less respiratory symptoms, less pulmonary exacerbations, and overall a much more healthy lung environment. If you're interested in participating in a trial, probably the first place to go is to your CF care center. Your physician can give you a good idea of what type of research is going on at the site, and also can give you sort of an insight into what other places around you may be doing studies that are of interest to you.